Hi Jane, my name is Sarah. I'm going to do your postpartum assessment, okay? And then the first thing I would do for a postpartum assessment, I would take your vitals. Any temperature above 100.4, we would want to report that because that can indicate infection. The blood pressure, we want to report it if it's either too low or too high, because too low, that can indicate that they're hemorrhaging and going into shock. And if it's too high, that can indicate preeclampsia. The pulse, if it's above 100, we definitely want to report that because that can be like one of the first signs of hypovolemic shock, and we want to catch that early because that can be life-threatening. If the pulse is a little low, it's okay. It's normal for postpartum moms to have a little bit of a lower pulse. So if it's like 50, 60, it's probably okay. Respirations, if they're too fast, that can be another sign of hypovolemic shock, so we definitely want to report that as well. And then oxygen saturation, I mean, if it's low, obviously we would want to report that because that can be another sign of hypovolemic shock if their body isn't getting enough oxygen circulated because there's not enough blood in their body, basically. All right, and then Jane, the first thing I'm going to do is examine your breasts. You would want to examine their breasts for, I'm just going to uncover you here, okay? You would want to examine their breasts for tenderness, any kind of cracking, redness, pain, anything like that. Are you having any pain in your breasts, Jane? And she says no, so yeah, they look okay to me, so we'll cover her back up. Alright, and then we're going to take a look at your tummy, Jane. We're going to take a look at that fundus and make sure it's nice and firm. And when you do a fundal assessment, you want to check the pad, and make sure you would want to check the drainage in there. If it's usually bright red right after they give birth, so that would be called lochia rubia. It looks like in here it's about maybe 4-inch stain, so I'd say that would be called a light stain. And then when you do the fundal check, you want to pull down the panties, and then you would watch for any more blood that comes out during your fundal check. So you'd want to place your non-dominant hand in the base of the uterus, and then with your dominant hand, you would kind of feel up here. It should be midline. If it's deviated to one side or the other, they probably have a full bladder, and you want to ask them to void first. So, Jane, do you have any urges to void at all? And she says no. I mean, sometimes they don't have an urge to void, even though their bladder's full, and if they can't void, then that would be an indication for a catheter. So, I mean, her fundus looks okay. It's midline to the umbilicus. So you'd place one hand here, one hand up here, and you kind of feel around for that fundus. And hers is about at the umbilicus, which is normal the first day after birth, and you want it to descend about a centimeter a day. If it's not descending at that rate, it's not normal. So you kind of feel it. Hers does feel pretty firm already, so you don't need to massage it if it's already firm. If it's not firm, if it's boggy, you want to massage it until it is firm. Because if it isn't firm, nothing is there to stop that blood, and they could start hemorrhaging. So I'm just going to work my way down and kind of push out those extra blood clots that are stuck in there. There's a little more that came out, so that's good. Alright, and her fundus looks okay. I'm going to roll you over, Jane. We're going to check your bottom, okay? Now the peri area after birth, it is normal for it to be bruised and tender. So, yeah, and I would have gloves on for this part. But you would assess for, like, if she had an episiotomy or laceration, you would want to assess that for redness, drainage, bruising, tenderness, anything like that, or infection. You want to make sure it doesn't have a continuous trickle of blood, because that is a bad sign. That can indicate hemorrhage. So she does look a little bruised and swollen, which is normal. You don't want any hematomas, though. If there's a hematoma, then that's not a good sign either. So, and then another important thing is their bowels. If they become constipated, that can be a bad thing. They don't want to push already because they just had a baby. Their abdominal muscles aren't back to normal yet, and so I always offer stool softeners. Really encourage them to take those stool softeners even if they haven't suffered from constipation. Also, the narcotic medication, they can get constipated from that as well, so you really want to push those stool softeners. Alright, and then the last thing, I would check her for any edema, but she looks okay. It is normal to have some swelling after birth, though, some swelling in the extremities, so that isn't normal if there's a little bit there. And then I would ask her, Jane, are you having any pain? Would you like me to get something for pain? And she says she's okay now, but if she would be asking for something for pain, I would get it for her. And then the last thing, I would assess her emotional state, her bonding with the baby, make sure she doesn't have any signs of postpartum depression. If she did, I would refer her to the doctor or counselor or whoever. But you really want to assess for that postpartum depression, because otherwise it can make a whole lot of issues down the road. So, all right, thank you, Jane. Do you need anything else before I go? And she says no, so I think that's all I've got.